So I'm Grace Bailey. I'm a researcher at Swansea University, part of the admin data team, which focuses on using social care data. And today I'm going to talk to you about a piece of paper that we've recently just had published. So this was to improve the ALF availability to allow for improved linkage to other data sets. So focusing on the children looked after data set. And this was a collaborative piece. So we worked closely with Alex Lee, who was co-developer on the code, and also the SAIL Databank team, which helped with adapting the code and getting it up and running. And so before I start talking about the code that we've published, I just want to give an overview as to why it's important. So I think the talks we've already had today really highlight why it's so good to be able to link to other data sets and what a wealth of information we can sort of glean from this. And then I'll go on to talk about the code itself. And so from a recent scope and review that we've published, we know that there's a real lack of evidence which looks at children's holistic journeys through the care system, into the care system and out of the care system, as well as their longer term outcomes into adulthood. And so I've just created this visualization to sort of see how we can use the admin data that's available within SAIL to follow these journeys through the care system. So you'll see the sort of different data sets that we've got within SAIL, so education, social care data, healthcare data, and criminal justice data, and the wealth of information that being able to link to these data sets allow us to explore. So as well as looking at children's pathways and outcomes, we can use this evidence that we get from this linked data to allow for earlier interventions, better provisioning of services, multi-sector agency working across these different healthcare services, education services as well. And also linking admin data has the potential to allow us to evaluate the effectiveness of the services these children are receiving. And not only can we sort of look at the child's journey as well and the wider, we've also got evidence, we've also got data to look at the wider environment. So we can link to the maternity data sets and look at perinatal, postnatal risk factors, which potentially may be involved in reasons and risk factors of why these children enter social care. We can also look at intergenerational transmission. So this idea that vulnerability may be passed from the parents down to the child, and this may leave them vulnerable to become involved in children's social care. But we can also look at the shared environment. So as Niall's talked about, we can look at the household as well. We can sort of focus on sibling studies to investigate this into more detail. And I won't go into too much details. You're probably all aware of how the ALF is assigned, but there's typically sort of deterministic methods, so using the NHS number, or probabilistic record linkage, which uses quasi-identifiers. So these are in SAIL name, date of birth, sex, and postcode. And so whilst these identifiers on their own do not identify an individual, when they're used in combination, we can make an ALF match to assign the ALF to them. And so this is problematic in the children's social care data because we don't have an NHS number, it's not a health data set, and only some of the quasi-identifiers which are used to assign an ALF are in the CLA data set. So in the blue box on the left, the data received by Welsh Government only includes date of birth, sex, and ethnicity. And on their own, that's obviously not enough to assign an ALF confidently. And so what Welsh Government do is they use the unique pupil number. So this is a number that's assigned to an individual when they first attend statutory education. And we link to the education data set to obtain the name and postcode. However, this is quite problematic because most children only start school at the compulsory age of 5. We do know that some children attend preschool before, and if that's a state school, they will be assigned a unique pupil number. And so as a result, there's a lot of missing linkage fields, the ALFs within SAIL, the children looked after data set. So only 37% of the whole data set have an ALF. And so we sort of speculated as to why this might be. And obviously one of them is definitely down to their education. So we know that a lot of children under the age of 1, so you can see on the pie chart on the right, around a third will enter children's social care before they turn 1, and more than half of them will enter children's social care before they reach mandatory school age of 5. And we also know that the children looked after a highly mobile population, so they move around a lot. And one of the ways that SAIL obtain an ALF, as I've mentioned already, is through the address postcode LSOA. And so if these aren't being regularly updated through their GP, then it's likely that we're less likely to link these children via the ALF. And there's some work in England which has sort of estimated that around a quarter of children will enter care and leave care before they reach school age, and they won't return. And this is really problematic because this means that around a quarter of all children who are looked after will never be able to be linked. This work is obviously limited to England, but given similar legislations and population demographics, it's likely that we have a similar issue here in Wales. And so here I just want to show the missingness of data of the children who have an ALF. So the problem isn't specific, as I've mentioned already, to Wales, although we do have the most missingness at 63%. Estimates in England around 25%. In Scotland, for children under the age of 5, this is nearly a third. In Northern Ireland, this isn't an issue because they have the NHS numbers collected as part of the children's social care data set, but we can see that there's still around a fifth, so 21% of children in Northern Ireland in the looked after data set who don't have an ALF. And this is potentially a big problem because we know one of the limitations of admin data is that it can introduce bias, in particular selection bias. So this is the idea where particular vulnerable groups are less likely to be able to be linked. So there's evidence that some characteristics determine linkability, so age, sex, ethnicity, and health status. And this can potentially impact the likelihood of what we can do with their data. And so it's really important that when researchers are using admin data, in particular the children looked after data set, that they explore how bias might be part of their research, and it should definitely be used to inform their study design as well. So as I've already mentioned, I don't want to take credit for the algorithm. Alex was very much lead on writing this, so I won't go into the technical details, but I've sort of created a higher level overview of what the algorithm did. So in the middle boxes, you can see the data sets that we used within SAIL Databank and how we linked them to obtain the missing ALF from the children looked after data set. And then the arrows on the left are the variables that we use to link the children looked after data set to the other SAIL data sets as well. And so the top two sets, we use a deterministic linkage method. So within the children's social care data sets, so the children in need and the children receiving care, we have a unique local identifier. And so this was just matched to pull in the missing ALFs for the children looked after. And then on the second step, we used the INR, which is the unique pupil number, which I've already mentioned, to pull in the missing ALFs from the education data set. And then the latter three was probabilistic record linkage methods. So there were different characteristics and variables used to determine whether or not the child was a ALF in other data sets. So the CAFCAS data set, which is the family courts, the NCCHD, which is the National Community Childhood Health data set, and then the GP data. And then the last column on the right, you can see where we pulled all these different data sets in. So this has now been published, and we've also published the algorithm on GitHub. So I would strongly encourage you guys to go away and have a look if you're really interested in that sort of higher level technical aspect of it. So once we ran the algorithm, we found that we had a massive boost in the number of ALFs. So we went from 37 to 61, so about 25% increase. The algorithm also corrected for errors in the data, so we knew there were inconsistent local identifiers which were given to the children via their local authorities, children's social care services. And it also corrected for inconsistencies with the week of birth by looking at the WDSD data set. And then we wanted to benchmark our algorithm to see how accurate it was. So what we did was use these children already identified in the children looked after data set, so this 37%, and we removed their ALFs and ran them through the algorithm to see whether or not our algorithm matched to the ones that had been given as the SAIL ALF, as they'll call it. So we found through our algorithm that 90% of them matched. There is a small incorrect mismatch, 1%. Obviously, because we don't have the raw data, we're not sure whether it was an error in our algorithm, probably more likely than it being an error in SAIL algorithm. And then 9% of the rest, the remaining 9% weren't assigned an alpha via our algorithm. So as I've already mentioned, in terms of potential of interest, introduction of bias, we had a look at how the ALFs were being assigned across different characteristics. So we looked at age group. So the diagonal bars at the bottom, you'll see those are the number of ALFs that had been assigned via the SAIL algorithm. And then the black ones were the additional ones that had been assigned by the boosted algorithm. So as you sort of expect, we see the big increase where we're pulling in the younger children under the age of 5, and then it sort of peters off when you sort of reach around 16 years and over. And we sort of hypothesized that this might be because we're using the education data set to pull in ALFs, and so these children are leaving education, so we're not able to identify them anymore. They're no longer at risk or considered to be at risk by Children's Social Services, so they're no longer in the Children's Social Care Support data sets either. And then we also did the same across deprivations, and we found that the number of ALFs assigned was fairly consistent across the quintiles. They were slightly lower, as you can see on the right, sorry, of the missing deprivations, so children were less likely to be assigned an ALF there, but this is potentially due to the missingness of the address, so the LSOA. These was one of the variables that we used as part of our probabilistic record linkage. And then finally, we were interested in looking at this across different ethnic groups. There is quite a variation in the ethnic groups which were assigned an ALF, particularly other ethnic group, but we know sort of from published research that this selection bias is quite common within ethnic groups. But I just put this here just because it's something we really wanted to highlight to researchers when they are using the data sets and how this should sort of be explored, especially if you're interested in looking at different ethnic groups, etc., as part of your research question. The other thing that I want to flag as well is, although the algorithm did try to, not as a primary outcome, but to reduce the potential bias that we're introducing, it wasn't possible to completely alleviate it. So we only used certain data sets. So for the CAFCAS, this only captures children who enter care as a compulsory care order. So we wouldn't capture any children who enter via voluntary arrangement. So really important to bear in mind when using the data. And then just quickly want to go through what we have planned. So we've currently had this data set provisioned to all research projects which are using the CLA dataset, or as it's known as SAIL-LAC. And anyone who does wish to put in for a new project in the future will have this provisioned alongside the old CLA dataset ALF, which is provisioned as standard. As I've already mentioned, this code is available on GitHub, and we do strongly encourage anyone who wants to develop it to do so. I think it was very much something that was a work in progress, not to say that it wasn't finished when we published it, it was, but of course there's ways it could be developed. One of the things I wanted to flag is that there's work in Scotland at the moment, and they're working with the local authorities to get those pseudo-identifiers, so the name and address, passed on to Scottish Government, so they don't have this issue where children under 5 years old aren't linkable. And I think it's something, if we could get set in motion with local authorities in Wales and Welsh Government, would be really beneficial. We'd see such a massive boost in the number of ALFs in the looked after data set. But lastly, I just wanted to highlight how being able to do this improved linked data set has been so good and has just such massive potential for future research projects, and as well benefits the children and their health as well. Thank you. Any questions?